Amoebiasis. Amoebiasis is an infection caused by protozoa, a tiny creature that can infect your body. It can result in bloody diarrhea. Infection occurs after ingesting amoebic cysts. Cysts are like the eggs of the amoeba, and they are ingested from contaminated food and water. When ingested, the cysts pass through the stomach to the small intestine, where they form amoebas, and invade the lining of the colon, causing tissue destruction and increased intestinal secretion, resulting in bloody diarrhea. Your job is to recognize that the most important symptom of amoebiasis is diarrhea with abdominal pain. Patients may have mild diarrhea or severe bloody diarrhea. It is important that you check for dehydration, check if the patient may have bloody stools, hydrate the patient, and treat them for amoebiasis. All patients with diarrhea are at risk for dehydration. Remember, you should check for signs of dehydration. Signs of dehydration include fast heart rate above 110 beats per minute, low blood pressure below 90/60, cap refill greater than 3 seconds, weak pulse, cold clammy skin or dry mucous membranes. Look at the tongue. If the patient is having bloody diarrhea, you should also check for signs of anemia. Signs of anemia include pale skin or pale conjunctiva. You can look at the cracks in the palms of the hands. They will become pale like the rest of the hand if the person has anemia. Or you can look for the mucosa of the eyelids. Red flags include the following. If the patient is severely dehydrated, which you will see if they have heart rate greater than 110, blood pressure less than 90/60, and cap refill greater than 3 seconds, you need to take them to the hospital for IV fluids. Other red flags include peritonitis, which is caused when severe disease causes the intestine to get weak and tear. This is called perforation. Signs of peritonitis include inability to jump, inability to sit up, pain with knocking the bed, rebound tenderness. Even one of these things means the patient has peritonitis and should be sent to the hospital. Other patients that should go to the hospital are those that are pregnant, malnourished, those with cancer, or who are taking steroids. Remember that you should consider amoebiasis in any patient with abdominal pain and diarrhea. Other symptoms include weight loss, fever, and mucus in the stool. When you see a patient with abdominal pain or diarrhea, you should ask the following questions. If you have pain, where is it? Do you know how this happened? When did your symptoms start? Does anything make the diarrhea or pain better? Does anything make it worse? What kind of diarrhea is it? Does it have blood or mucus? How many times a day are you having diarrhea? Have you been around anyone else who has been sick with the same symptoms? Are there other symptoms like any fever, any nausea or vomiting, any unexpected weight loss? Do a complete abdominal exam on the patient, including checking for peritonitis, feeling for an enlarged liver, or feeling for enlarged spleen. Treatment. It is important to treat patients with amoebiasis because if left untreated, the amoebas can spread to infect the liver, lungs, heart, and brain. All patients should be treated with metronidazole. The adult dose is 500 to 750 mg 3 times daily for 7 to 10 days. The dose in children is 35 to 50 mg or kg per day in 3 divided doses for 7 to 10 days. Alternatives to metronidazole include tindazole 2 grams daily for 3 days. Remember to have your patient come back in 2 days for follow-up. Remember to tell your patients how they can avoid getting amoebiasis. Prevention. It is very important to wash all fruits and vegetables with clean water before consuming. It is also important to only consume clean water. You can ensure you have clean water by boiling it. The high temperature kills off all the germs that were in the water.